before, his behaviors were like especially at homework time, he didn't want to hold a pencil, so he would cry. Anytime you asked him to write your spelling words, write your math, write stories was impossible. He couldn't, he would cry and cry and cry. And it was more about, there's some about, I don't know what to write, but it was more about, it's almost too hard to hold the pencil. So he had issues with that, which affected every subject. So then homework at night would look like me sitting there, for instance on math, I would say, 2 times 2. And what's 2 times 2, Max? And he would go 2 times 2, 2 times 2, 2 times, and I go, Max, 2 times 2. And I knew he knew it, but he just wouldn't focus. And so then finally he'd go, oh, it's too hard, And then I'd be like, Max, it's not too hard, you know what it is? And he'd go, oh, 2 times 2 is 4. And I'm like, yeah, okay. So now let's move to the next problem. And if it was double-digit math, it was like I had to do every, multiplication. You had to just keep him moving because he wouldn't move from one problem to the next. And a lot of times he would, say, when you're in the middle of a math problem, even if I was saying 2 times 2, he would go, oh, Mom, let me tell you what happened at school today. And he would go off on a tangent, or he would start crying and start a fight with you about, why he couldn't do it and why it was too hard. And finally, I just had said to him about a month ago that I'm not discussing anything with you except homework at homework time. If you want to tell me about your day, or if you want to cry about something, you have to do it after homework. So that helped a little bit, but still just the anxiety of just homework in general. Spelling words was like, I would have to hold the words myself, and I would have to tell him what letter to write next, because he would not be able to track between looking at the word and writing the word back and forth like that. And even if he had to write it twice, he wouldn't remember, enough to write it twice. And the handwriting is atrocious. You can't even hardly read it. This is all before. So then I would say first part of last week, he told me one day that he had a math test and a reading test he had to do at school. And he had stepped out to go to the nurse's station. And so when he came back into the room, the teacher said, you have these 2 tests, you need to get them done, and if you can't get them done, then you can stay in at recess and work on them when the room's quiet. And he said, okay. And then he told me, he said, Mom, I took those tests and I did them so fast, I beat the kid that's sitting next to me. And literally a week before that, it took him 2 days to take a math test, of her multiple times giving it to him for an hour at a time, and he would just sit and do nothing because it was too overwhelming to even start. He would cry at home, he'd cry at school, couldn't get over the anxiety of starting. So the fact that he did 2 tests in the amount of time and beat the kid next to him, and it was as if he didn't even realize that wasn't normal for him. It was like, I did it and I beat this kid, and isn't that great? And I was like, do you know what you just did? I'm like, that's not normal for you. And he was like, yeah, wow. And then, so that was a week ago. And then Monday we came in for therapy. And Monday when we got in the car, we have about a 30-minute drive home, so I handed him his spelling words. And I said, you need to write your spelling words. And he goes, okay. And he took the paper, picked up the pencil, and wrote 25 spelling words twice, and never looked up, never got distracted by what was going on around him, never asked me a question. 25 words in 3 minutes, done. And I was like, I started crying. Because I was like, I can't believe that he could do that, He's awesome. Never been able to do anything like that. So I took that, and after we had the big conversation about, do you know what you just did, and he was so proud of himself. And he goes, Mom, this is like other kids, the way other kids do their homework. I was like, I know. So then I said, okay, well, get out your math. See if you can do your math. And so he worked on that until he got home. And then when we got home, he got a little distracted because his sister was basically distracting him. But he completed the whole math paper without me helping him at all, without me reading one problem, without me normally the way math would go is I sit beside him and I keep him moving from problem to problem to problem because he couldn't focus that long.
Mm-hmm.
And he did the whole math paper by himself without asking me one time to help him. Then he had a writing assignment, and he was a little nervous about that because he historically doesn't write. He cries about it and all that. And I said, well, buddy, I said, I mean, look how you did your spelling and your math. I said, I think we should try it. And normally the way I would handle writing assignments is I would just let him walk around and talk while I would actually do the writing. I would ask him questions, and then I would write, because it was just too much trauma to get him to do it. And then he could copy it later, but even copying was traumatic. So I let him, so I said, sit down here beside me. And he had already written one paragraph in class a while back. And so I said, just copy that paragraph. And there was a few things like when he had done it before, and he had written this paragraph maybe like 2 weeks ago. So it was before I really started seeing improvements. So there was spelling issues, there was capitalization issues, there was punctuation issues. And yet when he sat down to even copy it, he corrected those things on his own without me telling him. And even spacing in his words, the way he used to write, every word touched each other, unless you would tell him, no. But then sometimes within a word, there would be spaces that were way too big that you couldn't tell where did those letters belong. And he was writing, and if he made a mistake like that, where two words were too close together, he would erase on his own and fix it without me having to say, hey, that's not big enough, or that's too far, or whatever. He'd just fix it and not cry. It used to be if I asked him to erase something, he would just melt down and cry. Erasing was like too hard, and you're like, it's erasing. And he would be so down on himself if he made a mistake. It was like he wanted to kill himself, he would say sometimes, just because he had to erase. And you're like, everyone erases. That's why there's no eraser on a pencil. But for him, that was just too much, stress. So anyway, he copied his first paragraph. Second and third paragraph, I just basically said, okay, what should this paragraph be about? Just asked him a few questions. He'd come up with a sentence, and then he would write it. And like I said, he would self-correct, and he did 3 paragraphs in about 30 minutes with no crying. And he got up a couple times just to take a break and come back. But, that's normally he's rolling around under the table, he's up and down, he's standing on his chair, he's sitting down, he's going under the chair while I'm doing the work, basically. And he just sits. And then that same night, he sat through dinner and never got up one time during dinner. And he normally couldn't sit for more than about 5 minutes. And then he'd be up getting something or doing something. And you're constantly saying, Max, sit down. Max, sit down. Come on, sit down at the table. And he sat the entire meal and just had conversation with us. And I just leaned over to my husband during the meal, and I was like, look who sat through dinner tonight. He was like, I know. It was just crazy. And it was just like kind of gradual, but over the last, I would say, week, we've slowly been seeing him be able to just mentally, emotionally handle things that he never could handle before. And so, I was like, this, and I just kept saying to him, do you see what's going on? And he was like, yeah. He was like, yeah, he does. Now, if I point it out, he knows the difference. Yeah. And so at school, he used to do things to kids like poke them in the head when he was walking in line, just quick spatial issues. He would be in people's personal space all the time and be touching everything and touching people and bugging everybody and constantly getting reprimanded for that at school. You need to keep your hands to yourself and all that. And now I'm asking him, how's your day? And he's pulling cards now for talking too much, but it's not for touching people and getting into their space. So, and he's not having personal issues with kids getting angry at him because he does weird things or says weird things to them. So even socially, we're seeing some improvements. So
that's awesome.
It's just amazing to me.
So would you say most of the improvements have been since we started the NeuroFeedback?
I would say yes, but that first test he took, the 2 tests really quickly, that was on the very first day when you did the brain mapping.
Okay.
So there was some improvement, I would say, even before that,
Before that, okay,
with,
just the
with the
brain-based therapies.
other
Yep.
therapies. I think that probably both are important.
Yeah.
Doing the exercises at home, I'm guessing, is
Mhm.
part of what started this, but still, we've seen the greatest improvement since we started the brain mapping.
Awesome.
So
That's so cool.
happy.